Hi everyone, my name is Kayla Keeney and I'm doing a case presentation response in regards of hemolytic anemia. The patient is a 27-year-old white female who works as a third grade teacher. The symptoms this patient presents are jaundice, chest pain, frequent headaches, vomiting, weakness, and decreased appetite. The relevant history of this patient is the jaundice vaginal birth, the child is a year old, anemia, patient received frequent transfusions in the past, anxiety, depression, and patient takes daily iron supplements. The physical findings were the patient has dry mucous membranes, yellow tinged skin, weak appearing, recently vomiting yellow secretions, has a headache radiating in the front of the head, 9 out of 10, recently has chest pain, 9 out of 10, with the EKG displaying sinus tachycardia and a blood pressure of 90/60. The patient reports the past couple days she has had a decreased appetite at work related to vomiting alongside chest pain and headaches. The patient takes daily iron supplements due to having 2 blood transfusions after having her child a year ago. The patient was recently at her primary care provider and was told to monitor her blood counts. Patient needs repeat labs in a month. The diagnostic is hemolytic anemia. The patient reports several symptoms related to this, such as headaches, chest pain, jaundice, vomiting, weakness, and decreased appetite. For this, there's several diagnostic tests, the first one being a complete blood count. This will let us know if her hemoglobin and her hematocrit are low. A urine sample, this will detect if there is any blood in her urine. A bilirubin to detect if there's any jaundice or not. The patient is a yellow tinge appearing, so this will tell us if there definitely is jaundice or not. And the haptoglobin, this can detect if there's hemolytic anemia. The treatment for this would be a blood transfusion. It is critical to know what type of blood to give the patient, so having a type and screen, as well as a complete blood count to know how many bags of blood this patient is going to need. It is also important to follow up after having the transfusions if it is working or not for the patient. Another way to treat the patient is to give steroids to help reduce inflammation throughout the body. This was based off one of the articles I found for this presentation by Hill and Hill back in 2018. And also it is beneficial for the patient to follow up with the hematology team to make sure what the best care of action for her would be moving forward and how to treat this anemia in her life. Thank you so much for listening to my presentation, and I hope you learned something about hemolytic anemia. Thank you.